day, sir. My name is Isaac Verano, and I'm your student from BSN 1C Health Assessment Lab. And today I will demonstrate or assess the abdomen. So the first thing to do is to introduce ourselves to the patient. What are the procedure that we will going to do, and how can he cooperate to our procedure that we will do. So the first thing that we will do is to put on some thin gloves. Oh, and I almost forgot to is to provide our patient's privacy. So after that, we need to introduce ourselves to the patient and ask what what is his name. So good morning po. Ano pong pangalan, sir?
Jan Ezra po.
So, Sir Jan Ezra, ang gagawin po natin yan ay i-assess ko po ang inyong abdomen o ang inyong tiyan para malaman kung may makikita tayong mga symptoms or any other infection. So, the thing that we will determine is to determine the client's history of the following, which is the incidence of the abdominal pain, bowel habits, incidence of constipation or any diarrhea, change in appetite, and food intolerances, and food ingested in the last 24 hours. And of course, we should not forget the specific signs and symptoms, and also the previous signs and symptoms that you may have experienced. The next thing that we will do is to place our client to an supine position with his hands both in his sides. And we will now place some pillows into his under his knees to reduce tension in the abdominal, and place some blanket for comfort. So after that, we will now check the size of the abdomen if it is normal or not with our measuring tape. So the next thing that we will do is to auscultate our patient's abdomen to see if there are any problems. So after checking or auscultating our patient's abdomen, we will now document it to our patient's chart, and we will now go on to the next procedure. The next thing that we will do is to percuss our patient's abdomen to see whether there are tympani or any dullness, and we will check every other quadrants of the abdomen. So after that, we will now also check or percuss the liver to check its size and he- and that's it. The next thing that we will do is to perform slightly palpation into his abdomen and to check if there are any muscle tension or muscle weakness. So the next thing that we will do is to also check for the liver if it is enlarged or if it is still normal. So after that, so the next thing that we'll do is to perform deep palpation to check the guy's abdomen. So after assessing the patient's abdomen, we will now document our findings into our patient's chart, and that's pretty much it. We are now done with our assessing of the abdomen, and thank you for watching.